Good morning, everybody. My name is Shamgar Ben-Eliyahu from Tel Aviv University. I'm a full professor studying the relation between the brain, the immune system, and cancer progression. And along the last 20 years, I and my physician colleague was following a path trying to understand whether surgery and stress-related surgery affect the progression of cancer, and specifically progression of cancer metastases. And as you all well know, most cancer patients can be operated and the primary tumor can be successfully removed. However, metastases are the major cause of cancer-related death. And we were aiming to prevent cancer metastases. And what we found out, starting with our earlier animal studies, is that the perioperative period, short time before and after surgery, and surgery itself, is a significant risk for progression of pre-existing micrometastases and initiation of new metastases. And actually, this short perioperative period has tremendous impact on long-term cancer outcomes, specifically on progression of metastases. And within this period, we looked for the mechanism, the reason that this period is so critical. And we found out that the perioperative period evoke both stress responses and inflammatory responses due to psychological stress, anxiety, adrenergic response, and tissue damage, inflammation, pain, etc. And those responses facilitate metastatic processes in a way that really enable metastases to go through a transition where instead of becoming dormant, they break out and they are detected as large metastases years later. So to block this effect, we purposely used two existing drugs, one that block adrenergic response, that reduce blood pressure, reduce anxiety, blocks the effect of adrenaline, and a second drug that block inflammation, block production of prostaglandins. And the use of these two medications in several animal studies was very efficient in preventing metastases after surgery and in saving lives. We then transfer and study the safety of this drug regimen and found it very safe. And we then moved into clinical studies, studying both breast cancer patient and colorectal cancer patient, using this same exact approach, using these two drugs, also called propranolol and etodolac in cancer patients. And we found out that the use of these drugs made the malignant tissue less aggressive, less metastatic, more easily controlled by the patient. We also followed colorectal cancer patients for 5 years, following treating them with the combination of the two medications. And we found out that the treatment reduced the chances of cancer recurrence or reduce the chances of metastatic disease. Out of placebo-treated patients, 50% approximately had cancer recurrence, metastases within 5 years, whereas in the drug-treated group, in our treatment protocol, only 12.5% of patients had experienced recurrence of metastases. So it seems that this drug regimen is effective, at least statistically. And what we need to do now is to conduct much larger studies in order to prove the efficacy of this treatment on a larger scale, in order to make it a routine treatment in a future treatment of colorectal and potentially other type of cancer. ICRF is a blessing to our studies, and we hope to continue our collaboration in the future. Thank you.